We have several of our providers who have said, we want to be able to see the images. We want to be able to see the images in a way that's easy for us, that fits into our workflow, that doesn't require a huge investment on our part. That's why we're working on implementing eHealth technologies.
The eHealth imaging solution allows the ability for our community to promote the reduction of duplicate tests and provide support for clinical decision making.
Having a patient treated in a rural hospital and then needing to be transferred to a trauma center some miles away, having an emergent workflow to access an image before the patient even gets there is crucial to treating that patient.
The trauma care physician is now able to use the zero footprint viewer to access patient images while the patient is en route to their facility.
We recently had a situation where a patient was being admitted for a higher level of care to one of our urban facilities, and the sending facility burned the wrong image study on the CD that was sent with the patient. The hospital was able to log into the virtual health record and pull emergently the original image exam and not have to retake that image.
HealthyLink is all about making it easy for doctors to get as much information, critical information, on their patients at the point of care. And having the image available to them at that time and within their workflow, from a business standpoint and from a quality of care standpoint, is very important to the hospitals.
We hear from our hospitals that they spend a lot of IT staff time trying to retrieve images, make the images viewable in their systems, provide their images to their patients to be able to be seen by other hospitals and providers, and it's a lot of wasted resources. This technology makes life so much easier for everybody involved.
What we hear from radiologists in our community is the need to be able to do a comparison of a current study with studies that were done previously. It could have been done at other radiology practices or hospitals in the community. So the ability now for them to get access to those images with a couple of clicks is an important feature.
We originally thought that primary care physicians wouldn't be as interested in image access, but we find that whether it's pediatricians or internal medicine providers want to be part of that care team. After the patient has seen a specialist and had a procedure and been to the hospital, they want a closed loop with that patient and they want to be involved and have all of the information.
It's allowing them to have a more holistic view of the patient's record and the patient's care.
Patients have they put a lot of trust in their doctors to make the right decisions for them. By having this information available to their doctors, that will make the treatment of that patient much more efficient. We know that anecdotally that unnecessary images are not being done because we're making that information available to their doctors